In a world where mental health awareness continues to grow, some conditions remain in the shadows, less understood and recognized than others. Among these is schizoaffective disorder, a complex condition that exists at the crossroads of thought disorders and mood disorders. Imagine living in a reality where your perceptions are altered by hallucinations or delusions, while simultaneously experiencing the extreme emotional highs of mania or the crushing lows of depression. This is the daily reality for approximately 0.3% of the global population who live with schizoaffective disorder, a condition that combines elements of both schizophrenia and mood disorder such as bipolar disorder or major depression. Schizoaffective disorder occupies a unique position in the spectrum of mental health conditions. Unlike schizophrenia, it includes significant mood episodes that substantially impact functioning. And unlike pure mood disorders, it features periods of psychosis even when mood is stable. Think of it as existing in two worlds simultaneously, one shaped by altered perceptions and thought processes, the other by extreme emotional states. This duality makes the condition particularly challenging to diagnose, understand, and treat, yet with proper intervention and support, many people with schizoaffective disorder lead fulfilling, meaningful lives. The condition is clinically divided into two subtypes: bipolar type, which includes manic episodes and sometimes depressive episodes, and depressive type, which includes only major depressive episodes without mania. Regardless of the subtype, all people with schizoaffective disorder experience psychotic symptoms similar to those seen in schizophrenia. These typically include hallucinations, sensory experiences that occur without external stimuli, such as hearing voices that others don't hear or seeing things that aren't physically present. Delusions are equally common. Fixed false beliefs maintained despite evidence to the contrary, such as paranoid beliefs about being persecuted or monitored, or grandiose beliefs about having special powers or importance. Beyond these psychotic symptoms, people with schizoaffective disorder experience periods of significant mood disturbance. In the bipolar type, manic episodes bring abnormally elevated energy and mood lasting at least 1 week. During these periods, a person might sleep very little without feeling tired, speak rapidly with racing thoughts, show impaired judgment, and engage in risky behaviors, feel extremely confident or grandiose, and become easily distracted or irritable. The contrast with depressive episodes can be stark. These periods of persistent low mood last at least 2 weeks and may include feelings of sadness, emptiness, or hopelessness, loss of interest in previously enjoyed activities, changes in appetite and sleep patterns, fatigue or low energy, difficulty concentrating, and sometimes thoughts of death or suicide. The cognitive symptoms of schizoaffective disorder often receive less attention, but can significantly impact daily functioning. Problems with attention and concentration make it difficult to focus on tasks or conversations. Memory difficulties affect both learning new information and recalling existing knowledge. Executive functioning challenges interfere with planning, organization, and decision-making. Processing speed may slow, making it hard to keep up with conversations or respond quickly to changing situations. These cognitive symptoms often persist even when psychotic and mood symptoms are well managed, creating ongoing challenges in academic, occupational, and social domains. What makes schizoaffective disorder particularly challenging is that these various symptoms don't appear in isolation. The interaction between psychotic and mood symptoms creates complex experiences that affect every aspect of a person's life. For example, depression might intensify paranoid delusions, while mania might make hallucinations more vivid or compelling. This interplay between different symptom domains can sometimes make it difficult for both the individual and their healthcare providers to distinguish where one symptom ends and another begins. As with most complex mental health conditions, schizoaffective disorder doesn't have a single cause. Current research suggests it results from a combination of genetic, biological, and environmental factors working together. Genetic factors clearly play a significant role. Having a close family member with schizoaffective disorder, schizophrenia, or bipolar disorder increases risk substantially. However, many people with the condition have no family history, indicating that genes tell only part of the story. Brain structure and function show some differences in people with schizoaffective disorder. Neuroimaging studies have found alterations in brain volume and activity in certain regions, particularly those involved in emotion processing and thought organization. Neurotransmitter imbalances, especially involving dopamine, serotonin, and glutamate, also appear to contribute to symptom development. Environmental factors may trigger schizoaffective disorder in genetically vulnerable individuals. These include prenatal exposure to viruses or malnutrition, birth complications that affect brain development, early childhood trauma or severe stress, and psychoactive substance use, particularly during adolescence when the brain is still developing. The condition typically emerges in early adulthood, usually between ages 16 and 30, a period of significant brain development and life transition. This timing supports what researchers call the stress vulnerability model, where genetic factors create a predisposition, but environmental stressors throughout life, particularly during critical developmental periods, can trigger the actual onset of symptoms. It's crucial to understand that no one chooses to develop schizoaffective disorder. It's not caused by personal weakness, poor parenting, or character flaws. Like diabetes or heart disease, it's a medical condition influenced by complex biological and environmental interactions beyond an individual's control. This understanding is essential not only for reducing stigma, but also for approaching treatment with compassion and scientific rigor. Diagnosing schizoaffective disorder requires careful, comprehensive assessment by mental health professionals. The process is complicated by the condition's overlap with other disorders and the fact that symptoms can change over time. According to current diagnostic standards, schizoaffective disorder diagnosis requires an uninterrupted period of illness, with a major mood episode concurrent with schizophrenia symptoms, delusions or hallucinations for 2 or more weeks in the absence of a major mood episode, symptoms of a major mood episode present for a majority of the total duration of illness, and confirmation that the disturbance is not attributable to substance use or another medical condition. Clinicians must carefully distinguish schizoaffective disorder from several similar conditions: schizophrenia with depression, bipolar disorder or major depression with psychotic features, substance-induced psychotic disorder, and other medical conditions that can cause psychosis. This differential diagnosis often requires multiple assessments over time to establish the timeline of symptoms when psychotic symptoms occur in relation to mood episodes. This often means gathering, including family members who can provide perspective on symptom patterns a patient might not fully recognize. Early and accurate diagnosis is crucial for effective treatment. Unfortunately, many people with schizoaffective disorder face a long diagnostic journey, sometimes receiving multiple incorrect diagnoses before finding the right one. This delay can postpone appropriate treatment and contribute to unnecessary suffering. The good news is that with increased awareness and improved diagnostic tools, clinicians are becoming better equipped to identify schizoaffective disorder accurately and initiate effective treatment sooner. Treatment for schizoaffective disorder typically involves a comprehensive approach targeting both psychotic and mood symptoms. The most effective strategies combine medication, psychotherapy, and psychosocial interventions. Medication often forms the foundation of treatment. For most people, this includes antipsychotic medications to address hallucinations, delusions, and thought disorders, mood stabilizers for bipolar type to help regulate manic symptoms, and sometimes antidepressants for depressive type to address depression symptoms. Finding the right medication combination can take time, as each person responds differently. The goal is to balance symptom control with managing side effects. Some newer medications called atypical antipsychotics can help with both psychotic and mood symptoms, which can be particularly beneficial for schizoaffective disorder. Several types of psychotherapy have proven helpful in managing schizoaffective disorder. Cognitive behavioral therapy helps identify and change unhelpful thinking patterns and develop coping strategies for symptoms. Family-focused therapy improves family communication and problem-solving, which can reduce stress and prevent symptom recurrence. Social skills training addresses interpersonal difficulties that often accompany the condition. Psychoeducation helps individuals and families better understand schizoaffective disorder, recognize early warning signs, and develop effective self-management strategies. Psychosocial interventions complete the treatment picture by addressing the practical aspects of living with schizoaffective disorder. Case management coordinates various services and ensures consistent care across different providers. Supported employment and education programs help maintain meaningful roles in the community. Housing support ensures stable living conditions, which are essential for recovery. Social and recreational activities combat isolation and improve quality of life. Peer support groups provide understanding and hope from others who have walked a similar path. Self-management strategies also play a vital role in long-term wellness. These include maintaining regular sleep patterns, as sleep disruption can trigger both psychotic and mood symptoms, managing stress through relaxation techniques and mindfulness practices, avoiding alcohol and recreational drugs, which can worsen symptoms and interfere with medication effectiveness, following a structured daily routine to provide stability and predictability, and recognizing early warning signs of symptom recurrence so that intervention can happen before a full relapse occurs. New technologies are increasingly supporting treatment for schizoaffective disorder. Smartphone apps can help track symptoms, medication adherence, and warning signs, providing valuable data for both the individual and their treatment team. Telehealth options are expanding access to care, particularly for those in rural areas or with transportation challenges. Online support communities offer connection and resources that complement in-person treatment. With appropriate treatment and support, people with schizoaffective disorder can lead fulfilling lives. Recovery is a personal journey that looks different for each individual, but commonly includes developing the ability to manage symptoms while pursuing meaningful goals. Many people with schizoaffective disorder maintain successful careers, particularly with workplace accommodations such as flexible schedules or quieter work environments. Supported employment programs can help match individuals with jobs that fit their strengths and provide ongoing support. Educational pursuits are achievable with appropriate accommodations, and many colleges and universities now have specialized support services for students with psychiatric disabilities. Meaningful relationships are an important part of recovery. While social challenges can be part of the condition, many people with schizoaffective disorder build and maintain strong connections with others. Open communication about the condition, its symptoms, and its treatment can help friends and family members provide appropriate support. The right balance of independence and assistance is key. Too much help can foster dependence, while too little can leave the person feeling overwhelmed. Throughout history, many talented individuals have managed conditions on the schizophrenia spectrum while making significant contributions to art, science, literature, and other fields. Their stories remind us that mental health challenges, while difficult, don't determine a person's potential or worth. With treatment, support, self-management strategies, and resilience, people with schizoaffective disorder can build lives of meaning, purpose, and connection. If someone you care about has schizoaffective disorder, your support can make a tremendous difference in their recovery journey. Educate yourself about the condition to better understand their experiences. Listen without judgment when they want to talk about their symptoms or struggles. Encourage treatment adherence, as consistent care is essential for managing the condition. Help identify early warning signs of symptom recurrence, which the person themselves might not immediately recognize. Support healthy lifestyle choices that contribute to overall wellness. Be patient during difficult periods, remembering that symptoms are not within the person's control. And perhaps most importantly, take care of your own needs as a supporter, as maintaining your own well-being allows you to be there for your loved one in the long term. Understanding schizoaffective disorder means recognizing both its challenges and the possibilities for recovery. By combining medical treatment, therapy, support systems, and personal resilience, people with this condition can build lives of meaning and purpose. If you or someone you know is experiencing symptoms of schizoaffective disorder or any mental health condition, remember that help is available and recovery is possible. Reach out to mental health professionals, community resources, or crisis services. No one needs to face these challenges alone, and with proper support, those living with schizoaffective disorder can navigate their dual realities while creating a life of quality, dignity, and hope.